Welcome everybody. It's great to have you with us. We'd like to welcome you to Palliative Care Queensland's 2020 election event. Thank you for joining us, and we thank those who will view this broadcast later on. My name is John Harberek. I'm President of Palliative Care Queensland, and I'd like to begin by acknowledging the traditional owners of the land wherever we are. Here in Brisbane, it's the Yagara and Turrbal people, and we pay deep respect to their elders past and present, and those still emerging, for their custodianship of the land and the waters on which we are. And I also acknowledge any Indigenous people online today. So at Palliative Care Queensland, we believe that the way we care for our dying is a significant indicator of the kind of society we are. Our priorities are that all Queenslanders are able to live every day until the last, are able to have a dignified death regardless of illness, age, culture, or location, and that they have access to a supportive social network at the end of life and have the choice of quality palliative care. It's important for us to gather today to mark the upcoming state election on the 31st of October and to share an election ask that's been put together that seeks to create a purpose-built palliative care system for all Queenslanders. This election will be a historic occasion for at least two reasons. First, it's the first election to be covered by the Constitution Fixed Term Parliament Amendment Act 2015, where all future elections will be every 4 years on the final Saturday in October. And secondly, because healthcare, we believe, will be a significant deciding factor in this election. Voters who will make their decisions have seen the challenges of the COVID-19 pandemic and the benefits of a fully funded health service when a service is staffed by highly trained and expert healthcare professionals. This election is also a unique opportunity for peak bodies to advocate for positive changes in the sector and to secure critical commitments from all sides as to how they will fund and manage key initiatives and programs in their term of office. At PCQ, in the run-up to the election, our team of policy experts have liaised with stakeholders from our community of care, including the Queensland Specialist Palliative Care Medical Directors Group and the Australian Medical Association, as well as our state, local and national networks to develop a wish list for the sector. One that, if implemented, we believe will see positive, lasting benefits for all through the creation of a purpose-built palliative care system for all Queenslanders. So why is this purpose-built system so desperately needed? We know that in Queensland, there are amazing examples of palliative care services. We also know there are gaping holes in resourcing and training, a lack of specialist services, fragmented and disjointed funding, and inadequate delivery models. We have to fix this. That's why we're all here today, finding ways to improve the quality of care received by Queenslanders and their families is part of the mission of Palliative Care Queensland. I'll turn over shortly to Shiloh Mills, the CEO of Palliative Care Queensland, who will go through the details of the funding ask in just a few moments. After Shiloh, we'll hear from AMA Queensland President, also a specialist palliative care clinician, a consumer, and then from the political parties, the Greens, the Liberal National Party, and Queensland Labor. However, before I invite Shiloh to speak, I'd like to go over a few housekeeping items so that you know how to participate best in today's event. At the bottom of your screen, you will see a chat function. I invite you all to interact with us now and type in your postcode, suburb, or town to share with us where you're from today. Please ensure you select the option to chat with panelists and attendees so your fellow audience members can see your comments. For questions during the webinar, please use the Q&A function, which is at the strip at the bottom of your control panel. We'll try to answer as many questions as we can, and any that we can't, we'll follow up later. Please note, we'll be recording the event and it will be shared. The link will be shared with the public after the event. So I'd now like to introduce Shiloh Mills, the CEO of Palliative Care Queensland, who will present our election manifesto.
Thank you, John. So I'd like to invite us all to take a moment to remind us of why we are here today. We're here to discuss one of society's greatest taboos, yet possibly the only thing that every Queenslander will experience: death. But not just that, we're here to talk about the support networks which surround people and individuals that have a diagnosis of a life-limiting condition, right up to the moment that they die, and continue to care for the loved ones surrounding them after they've died in bereavement. That is palliative care. These support networks are made up of their family, friends, work colleagues, neighbours, clubs and group members, as well as community and health services and supports. That is palliative care, and palliative care is everybody's business. Most people perceive palliative care as a medical team, usually administering morphine to someone experiencing severe pain in the last few days of life, and surrounding them is a family suffering and powerless to make a difference. That's not palliative care. Most people don't perceive palliative care as a supportive network of individuals, families, friends, plus health and community members surrounding that person who has a terminal illness but may have at least a year to live. Most people don't think of palliative care as helping the individual and their families to identify their goals of care, their bucket list items, and then discussing strategies on how each person in that supportive network can play a role to help them achieve these goals. That is palliative care. Palliative care is not just the last few days of life. It's relevant for anyone with a life-limiting illness, including people with chronic illnesses, those still receiving curative treatment, for babies in the womb who are unlikely to survive the birth, and for people intubated in an intensive care unit not likely to survive the extubation process. That is palliative care. Death does not automatically equal suffering, pain, and fear. Death is not something that society should avoid until it touches them or a loved one close to them. Death is something that we all need to prepare for. It's something that every people in this webinar, every Queenslander, every person who votes in this next election, everyone will experience palliative care, death, dying, loss throughout their lifetime. That is why this is so important. Death is simply a part of life, and palliative care is needed for everyone. Today that we're not voluntary assisted dying or VAD. Palliative care is needed with or without VAD. PCQ is neutral on that debate. But we remind people that VAD, or voluntary assisted dying, would only be available for 1% of the population. What we're talking about, palliative care, needs to be available for 100% of the population. And that is why this is what we're focusing on in this discussion. The Queensland palliative care sector is significantly underfunded. This was demonstrated clearly in the recent Queensland inquiry, also in the Queensland Palliative Care Services Review 2019. and continues to be noted regularly in the Royal Commission into Aged Care. We all know that it's underfunded. It's time to make a change. We can't continue like this. Our sector can't continue to operate at stretched capacity, operating off minimal funding, working excessive hours and often after hours and in their own time, because we can't leave people in need. And we'll hear from different clinicians today about that. Many of our services have to close their books, reduce their admissions, because there's simply not enough staff or funding for them to continue to offer the support that we would like to offer, which is the level of the World Health Organization's recommended level of palliative care. So today we are giving a clear, transparent and accountable roadmap for transforming the palliative care sector in Queensland. Anything less is simply not acceptable anymore. I'll jump to my PowerPoint now. The Queensland Specialist Palliative Care Medical Directors, Palliative Care Queensland, our members and AMA Queensland all agree that this is needed for palliative care. There is a link to this document within the chat function, so you can all access that and we'll send it to you all after. We agree that 275 million new funding per year is needed with a two-prong approach. Now that seems like a big number, but really that equates to $53 per Queenslander, or approximately one coffee a month per Queenslander. Now, I think we can afford that. So the two-pronged approach goes through palliative care service delivery as prong one, and also capacity building. The palliative care service delivery, prong one of the funding, includes 4 different areas. This includes palliative care home care packages. There's 3 different packages involved in this. Last days packages, palliative care community packages, which would be for the last 6 months of life, and mass packages, which include equipment and support packages as well, for syringe drivers and equipment close to home so people can have them accessible at home. We have specialist palliative care workforce funding, which includes palliative care medical physicians, palliative care nurse specialist workforce, palliative care allied health specialist workforce, palliative care administration support, including volunteer coordinators, palliative care clinical educators, and advanced care planning facilitators. This demonstrates that palliative care is a holistic workforce and all these areas are needed. There are targeted palliative care service delivery programs, which includes First Nations palliative care support, hospice and specialist NGO or non-government organisation support programs, a specialist palliative care rural telehealth service called Sparta, Palliconsult to continue, the Office of Advanced Care Planning and the statewide paediatric palliative care collaborative outreach service to continue, aged care palliative care support, a statewide bereavement support program, and a statewide spiritual care support program. There's also a technology investment that's needed, and never before have we seen that more than now during COVID. Prong 2 looks at the capacity building required, which enables this to be a sustainable model of funding for the state. This includes 4 areas as well. Specialist palliative care training and workforce development programs for medical training, nursing training, and allied health training. It includes investment in workforce research, quality improvement, and innovation. This includes a database registry, so we can look at the data and demonstrate the need of palliative care better. It also includes funding for Centre of Palliative Care Research and Education, including research grants, fellowships, and scholarship funding. It looks at policy engagement, awareness raising, and last wishes, including the continuation of Palliative Care Queensland and Ambulance Wish Queensland rolled into more areas across the state, so people can receive their last wishes. And finally, it looks at capacity building, engagement, and development. And this looks at a statewide palliative care volunteer program, which many of the other states have across Australia, but we do not have here in Queensland. And a Queensland Compassionate Communities, working with community to build engagement and capacity across the state. This is what we believe is needed for palliative care across the state, and it comes to 275 million new funds per year. I now close with a message to Queensland MP candidates for this election. And I'd like to remind them all that is needed to ensure that Queenslanders have access to palliative care at the level of the World Health definition equates to less than 1 cup of coffee per Queenslander per month. And just for them to consider, imagine if your constituents really cared about their members' health and social well-being. Imagine if that care extended to the dying, death and loss experienced by everyone in your electorate. Imagine how your electorate could support you and your family in your own death. What would your community look like? And I hope this document today has given some clear guidance of how that could happen across Queensland. Thank you.
Thank you, Shiloh, for that comprehensive and very detailed ask for palliative care funding. I'd now like to introduce Associate Professor Chris Perry, President of AMA Queensland. Dr. Perry has been a member of the AMA since 1977 when he graduated from the University of Queensland. He's chairman of the multidisciplinary head and neck clinic at the Princess Alexandra Hospital and an immediate past president of the Australian Society of Otolaryngology Head and Neck Surgery. He has a strong interest in medicine in remote tropical areas and for socially disadvantaged people with a special interest in Aboriginal health issues. Dr. Perry is unfortunately unable to join us today, but has kindly provided a video message which we will watch now.
I'm the current president of AMA in Queensland, and I'm here to represent the AMA in Queensland to support the reforming of palliative care within our state. We know it's chronically underfunded, all the way from paediatrics to geriatrics. Currently, palliative care is better in some postcodes than others, which is just completely unfair, especially to rural people in provincial cities, but also postcodes within Brisbane itself. We know this because there's been an inquiry into palliative care, aged care and end of life. Reports have come out, and there's also been a Royal Commission into aged care with unhappy and poor results throughout the country, but also here in Queensland. We're seeking more than $270 million to try and address this issue. This is a combined effort of the AMA in Queensland with our partners, Palliative Care Queensland, and the Queensland Specialists in Palliative Care, the Clinical Directors Group, who are the leaders of the palliative care services within Queensland. So this is not a small fly-by-night group. We are in league, in cooperation with the real palliative care delivering people within Queensland. It's what's needed for the best practice. It's what's needed to catch up with other jurisdictions who have similar sums of money being spent on palliative care in their states. There's an election coming, and it's important that our political parties tell us what they're going to do about this. They've had plenty of time to put things together. It's a very delicate time in Queensland, especially with palliative care. There's lots of discussions about end of life decisions. And most people would be satisfied that good quality palliative care is what they want for themselves and for their families and their relatives. Good palliative care makes it easy for people in their last months of life. That's what it's all about. Good, well-funded palliative care is what Queensland needs, and in this election period we call on the major parties in Queensland to tell us what they will do for the most disadvantaged and potentially dying people within our community, from children to elderly adults. Thank you very much.
Hi everyone. Palliative care and death is something we don't talk about enough.
So we thank Dr. Perry very much for those words and for his strong support of palliative care. I'm now pleased to introduce Associate Professor Philip Good, a specialist palliative care clinician in Brisbane. As well as an active clinical practice, Philip is involved in research on clinical therapeutics in palliative care, qualitative research on the patient and carer experience, and the experience of culturally and linguistically diverse communities in palliative care. Please join us, Philip.
Thanks very much, John, and thanks very much for the opportunity to speak today. I'm a member of the Queensland Specialist Palliative Care Medical Directors Group, and as Chris Perry said, between ourselves, Palliative Care Queensland and the AMA, we're very keen to see improvements in funding for palliative care in Queensland. As a specialist palliative care clinician, I see firsthand the benefits of palliative care for Queenslanders. I see suffering relieved, families supported, patients articulate what matters most to them, and families have access to care and support services that enable their loved ones to die with dignity, grace, and surrounded by their loved ones, hopefully in the place that they choose to die. I have the privilege of working with amazing holistic clinical teams every day. I've seen their expertise make a genuine difference to everyone involved. People often ask if my job is sad or our job in palliative care is sad. I don't think it's sad. Our job's a real privilege and an opportunity to be involved alongside patients and families as they journey through a very difficult time, and we aim to provide symptom support, emotional, spiritual, and social support. Our job doesn't offer a cure or a solution to death, but it does change lives, not only of the person involved, but the person around them. When palliative care is fully there, we can make a big difference. But sadly, for many Queenslanders, palliative care isn't available or isn't available as well as we would like for everyone in Queensland. Our sector is frustrated that we cannot help every Queenslander during their final journey, and that patients cannot access services equally and equitably throughout Queensland, and that sometimes people have to travel thousands of kilometres to receive care they should have it close to their home. As was said recently with a state government inquiry into aged care, palliative care and voluntary assisted dying, the next state government has a unique opportunity to truly reform the palliative care sector in Queensland, to improve access to care, to invest in clinical professionals and expertise that will make a difference on the front line. As a clinician, I can do my job. As a palliative care team, we can do our jobs. But we need more support to ensure that all Queenslanders have access to palliative care. I wholly support the request for an additional $275 million in funding for the palliative care sector and endorse a roadmap that has been developed by the stakeholders involved. We have the opportunity to provide every Queenslander with excellent palliative care, and I encourage every political party to commit to funding the sector and enabling this transformative change that we need. Thanks very much.
Much, Philip. That perspective from yourself and other clinicians is so important in supporting our ask for increased palliative care funding. And now from, and I'd also like to acknowledge the support of Dr. Greg Parker, who's chair of the Specialist Palliative Care Medical Directors Group. And now from clinical to community, I'd like to introduce Michelle Burns, who is a consumer in palliative care. Michelle can't join us today, but has also provided us with this pre-recorded video.
Hi everyone. Palliative care and death is something we don't talk about enough until we are actually facing it with our loved ones. We always assume that there is enough funding for this sort of support to be available to everyone in the community, but this isn't the case. Access to palliative care should not be for a selected few, but available for all Queenslanders. My mum was fortunate to experience palliative care here in Townsville. I know just how important it was to her and to my family during that difficult time. There have been 2 Queensland government inquiries into palliative care over the last decade, and still this sector hasn't received a significant funding boost. Palliative Care Queensland's request for an additional $275 million is crucial to ensure that we all have access to this care, regardless of age, gender or postcode. I am calling on all political parties to provide all Queenslanders with access to palliative care, a recognised human right. If there is one certainty in life, it is that at some time we will die, and we will have the opportunity to improve the end-of-life care for all. I encourage the next state government to commit to this funding. Thank you.
Michelle, for that eloquent outline of why palliative care is so important for all Queenslanders. We had hoped to now have a video message from the Greens Party, but unfortunately we're not able to get that. But we do have a strong message of support from Michael Berkman, member for Maiwar in Brisbane's Inner West. Michael's been the member for Maiwar since the 2017 election, when he became the first Greens member to be elected to the Legislative Assembly of Queensland. We now have a short video address from Ros Bates. Ros is the Liberal National Party Shadow Minister for Health and Ambulance Services. She sends her apologies. She's busy with campaign activities, but has provided a short message in support of PCQ's state election campaign.
Hi, I'm Ros Bates, the Shadow Minister for Health and Ambulance Services and the Shadow Minister for Women. I'm so sorry that I can't be at the event in person, but thanks to Shiloh Mills, the CEO, for the opportunity to send a video message. I would also like to thank everyone here for your commitment to getting the best standards of palliative care in Queensland. As a registered nurse, I know how important these services are for patients and their families. We healthcare workers have some of the most challenging and rewarding careers. The LNP are committed to ensuring we provide the end-of-life care that Queenslanders deserve. We have already announced a major funding boost of $600,000 for the Noosa Palliative Care Facility at Katie Rose Cottage, which we know will benefit the organisation and the community. Only the LNP has a plan to invest in health services, and this announcement shows how committed we are to palliative care in Queensland. Thank you to everyone and best wishes for the remainder of the election event.
Thank you very much, Ros. I'd now like to introduce the Honourable Fiona Simpson, also a member of the LNP, who represents the seat of Maroochydore. Fiona, just a quick question. Having heard from the sector's key stakeholders, what do you believe should be the key priorities for the next state government across their 4-year term and beyond?
Well, in respect to palliative care, which is what we're talking about today, it has to be very much about designing a reform that's done with the sector. And I, as a number of you know, had personally experienced what good quality palliative care can do when I was my father's carer when he was dying of cancer 3 years ago. And the best advice I got early in the piece was from a palliative care nurse who said, get a palliative specialist involved as early as you can. And our experience here on the Sunshine Coast was actually a very, in the midst of the grieving and journey of travelling alongside of a family member, it's hard, but I'm so grateful for access to quality palliative care. I believe that the program that you've outlined in identifying that not everyone has access, that it's fractured, that the funding, the systems do need reform. indicates quite clearly it needs to be a reform that's done transparently, and that's something I've always believed that with the health system. Dollars, absolutely. You've got to have the dollars, but you also have to make sure you can see the dollars and where they're being spent, because the acute health system is a hungry entity and it needs a lot of funding, and it's vital that it has it. But palliative care, unfortunately, when you're dealing with such a sensitive and difficult time, people are too vulnerable to be advocating when they're in the midst of this. So that's why we have to have the health professionals and those who know how the system needs to be designed, because you can't wait till someone's needing the service for them to have to advocate that they need it. And not everyone's getting the quality service that they need now. So first priority in respect to reforming palliative care, we've announced that we'd also, with a palliative care task force, with key representatives such as Palliative Care Queensland, would be able to ensure that we're able to reform the system with those who are delivering the work, because currently we know that there is tremendous holes within the delivery, and we need to know that everyone has access to quality palliative care.
Thank you so much, Fiona. And I hope you will be able to stay for the Q&A session in case there's any questions that you might be able to answer. So I'm now pleased to introduce Joe Kelly, Labor member for Greenslopes. Joe is a registered nurse who completed his training at the then Royal Brisbane Hospital, and I know is a passionate supporter of palliative care. Speaking to us today in the unavoidable absence of the Minister and Assistant Minister for Health and for Ambulance Services. So Joe, I'm going to pose that same question that I did to Fiona. So having heard from the sector's key stakeholders, what do you believe should be the key priorities in the palliative care context for the next state government across their 4-year term and beyond?
Yeah, well, look, I think, thank you, John, and thanks to all the members here. And by way of declaring my affiliation, I am actually a member of Palliative Care Queensland. I think I'm paid up to date. If I'm not, that's administrative oversight, but I certainly am in spirit, if not in financial dollars, but very happy to be associated with your group. I think I'd like to echo something that Fiona said there. She's correct in saying that anything that we do has to be done in consultation with the stakeholders, the key stakeholders, moving forward. You know, as someone who's been on both sides of the palliative care service, you know, both as a practitioner and then as the son of my father who passed away, I think I've seen palliative care services up close and personal, and would have no doubt some things to add into I guess any discussion around palliative care moving forward. From the perspective of our government, there's, as you would be well aware, we undertook a fairly significant review of palliative care in 2018 to identify the you know, the current and the future palliative care needs. And you'd be aware of some of the outcomes of that. But I think the recommendations that were made by a parliamentary committee, I think it was all aspects of end of life care, were accepted by the government. And I was really pleased with that, because I was very, very keen to see that particular committee not just tackle the issue of euthanasia, which was widely reported in the media, but actually look at not just palliative care, but also, you know, how well the My Aged Care system serves our community, how well we go in aged care, and how across a whole range of end-of-life care issues. And look, there's, I guess, 5 key issues that I think we acknowledge and recognise as a government, and we'll. I'm not in a position to make any announcements in relation to these matters, but I have no doubt that the Minister will be at some point in the next 18 days addressing these issues. We know we have to increase the volume and the quality of services, and I think the quality of services is really important. I can tell you as a practitioner, the last time that I was involved in palliative care was as a nurse on the rehab and stroke unit, and usually it was for patients, well, if we were doing our rehab job right, it was always for the stroke patients who came in following a significant stroke. But oftentimes, and I'm not a trained palliative care nurse, but we were attempting to manage palliative care while also caring for people who are undergoing acute strokes and the immediate treatment there, as well as managing patients undergoing rehabilitation, as well as inevitably looking after patients that have been outlined to our ward from medical wards. So that quality of services, I think, is really important, and to make sure that nurses and doctors have the time and the space to properly consider the needs of their patients and develop a really good care plan. And importantly, the best possible therapeutic relationship that you can develop. Often in the sort of acute and subacute settings, you have very limited time to develop palliative care relationships. I know in the stroke unit, it was often a matter of sort of days that you had to work with families, whereas in my wife's situation, she's in charge of the oncology unit at Greenslopes Private Hospital, and of course their relationships with the person and their family and carers can span years. The second area that I think we need to think about, and it's something that we deal with all day long in life. In fact, we're sitting here on a Zoom conference, which would not have happened 12 months ago. I can assure you that, because I wouldn't know what Zoom was. I wouldn't know how to use it. But we need to start to use innovative services that take advantage of technology, particularly around that promotion of equity of access to palliative care for all Queenslanders. We know now that this wonderful tool of Zoom or Teams or whatever other version of this that you want to use has connected our community in ways that it could never have been connected before. And I think we've got to look for ways and opportunities to harness that. I certainly know for my mum, who's currently in an aged care facility on the Sunshine Coast and just started that journey in December last year, to go into lockdown from sort of more or less February onwards has been tough. And so the use of technology for my fairly large and extended family to stay connected to each other and to mum has been something that's been really quite good. Of course, we have to focus on person-centred and flexible palliative care. We can't just assume that one model will fix and fit all families and patients. We have one of the most decentralised states, if not, sorry, the most decentralised state in Australia, and we know there's a whole range of different cultures, different values, and even just different environmental situations that people live in. So we have to be flexible and think about how we deliver that service, and it has to be really driven by what does the actual person at the centre of receiving the palliative care services need. We certainly need a viable and sustainable palliative care system supported by a skilled specialist workforce. And I think that's where the review in 2018 was very good. It's given us some indicators as to how to get some policy settings which are really aimed at a sustainable approach to palliative care. Not just sort of building a little bit of a unit here or funding a few extra nurses here, but how do we actually build a system that is like our acute care health system that is robust and sustainable. And look, I think the last thing that we have to really think about, and the government has accepted this, is just, I guess, improving, systems improvements that are focused on patient outcomes. And what we're really looking at there is sort of getting some accountabilities for the investment that we're putting into palliative care, and making sure that the dollars that we're spending are being spent wisely and are actually delivering good outcomes for people who are receiving palliative care and their families. So I'll pull it up there if you like, John and Shiloh. Sorry, you folks are on mute.
I think I'm muted. Am I unmuted yet? Thank you very much, Joe. Great to hear from all of you from the various political parties. We now have questions and answers. Are there any questions?
John, could I just say a couple of things before we go to Q&A?
Sure, Joe.
Just really quickly, away from the question that you asked. And I'm really pleased to see Fiona here today, because she and I do discuss palliative care across the aisle. It does happen. The media doesn't like to tell you that sometimes we talk to each other and play nice, but we actually do. But you know, I often feel like I get trotted out to these things as the token nurse in the Parliament for our side of things. But can I just say, on all sides of the Parliament, there is deep interest in palliative care. And so while I certainly come here as a practitioner, I don't come here as the sole voice of palliative care in our Parliament. Every member that I've spoken to about these issues thinks deeply about them and are deeply concerned. They may have slightly different views on how to tackle the problem, but there's no disagreement that the issue is important.
Thanks, Joe.
We have one question in chat.
Yes,
So we have a question received prior to the event from a nurse practitioner up in the central Queensland. Is there capacity and resources to review regional areas such as Hervey Bay, where the deficit is in low numbers of nursing staff within the domiciliary services? This is contributing to patients often ending up in hospitals due to limited support and contact from the services, particularly after hours and on weekends. So I can respond in the request that we've asked for. It does include regional services, and there's quite a strong focus of support, including staffing support, which looks at both specialist and generalist and primary palliative care space to ensure that no matter what, someone is cared for in hopefully close to home, in a place with their family, a familiar place with surroundings around them and family close by as well. So that would be included in this ask that we have today.
Unmute myself. Now, obviously, I'm not the Shadow Health Minister, and there are more announcements to come during the course of the campaign, but I think I may be down the road at the Sunshine Coast, but I am aware that the Hervey Bay in particular, and there are many others as well, is an area that is particularly underserviced. And so you cannot ignore that. It has to be addressed. So I'm not the one to present to you as to here is the funding envelope for Hervey Bay. I think the true truth of what's required is in really getting to the bottom of how to address the shortfalls in the service. And I just want to follow on from Joe and thank Palliative Care Queensland as well with the presentation and the what you've put together, because the answers will be not in an ad hoc or a piecemeal way, but having very great clarity about exactly what needs to be addressed and how to build those services, and then transparency of access. And when there are issues where there are particular failures in service, it needs to be clear, because one of my concerns has always been that wonderful services in our acute care system, but it is a very hungry entity, and that people go on holidays and don't always get backfilled into key roles. And palliative care is one of those areas, and other services that can find that on paper they've got a service, but in reality it's not actually funded for backfill when people are away. But I know it's more than that in Hervey Bay.
Yeah, thanks very much for that question. It's a good question. I'd like to just sort of put some historical context around this question as well. Probably I'm much more familiar with, I guess, the history of rehabilitation care in our health system. But when I started as a nurse a mere 32 years ago, we didn't have a rehabilitation service at the Royal Brisbane Hospital, which was the quaternary hospital for the entire state. Nor would I have suspected we would have had a palliative care service in those days, or a whole range of other services that we have now. And oftentimes we sometimes take them for granted. In fact, I remember when the rehabilitation service at the Royal Brisbane Hospital was opened, and I've had the privilege of working there from 2012 to 2014, and Garu, and I'm going to be here to see that closed down and moved up to the new STARS program there at the Royal Brisbane Hospital. But my point of this is that it's not surprising to me in areas like palliative care and rehabilitation, that we are continuing to see development in services, because many of these services in a historical context are actually quite new, and there's still a lot of development and research in our thinking going on around these things. Certainly the 2018 review identified that there was a really significant maldistribution of hospice and in-home services, clustered primarily in the southeast corner, and so that has been recognised, and Palliative Care Queensland have advocated strongly, not just in the run-up to this election, but in an ongoing way in relation to that particular issue. And we've certainly invested $17 million of new funding in 2019, 2020 and 2021 for palliative care services in community-based settings, specifically focusing on those areas outside of southeast Queensland. But I will echo again what Fiona's saying. I'm not, like Fiona, I'm not the minister or the shadow minister responsible for this area, so I can't give you specifics around resource announcements and funding announcements in relation to those. But I can point to that track record, and I think it's well documented from that review, and we've certainly started to try and address those issues.
Thank you both for those responses. Do any of the other panelists present have any comments?
Philip Good here. I just like to agree with the question, in that I think from a clinical point of view, and certainly from the Queensland Directors Group point of view, we're very aware of differences around the state and between different places. And I think, as people have said, whatever is put in place, and certainly in the document that's been produced, is very much a statewide approach. So we all see it as improving funding and services across the state. And we certainly don't think it's about getting a minimum standard in a certain place. It's about providing excellent palliative care to everybody in Queensland, no matter where they live. That's the aim that we would come from to start with, and I think the priority that we have. So I think that's where we've got to start. We've got to, as people have talked about, we've got to overcome this tyranny of distance using different technologies, but I don't think it's good enough for any of us to say that it's because someone's in a different place, rural, regional, remote, wherever they live, that they shouldn't get as excellent care as anyone in anywhere else in the state.
Shiloh, we've got another question.
Yeah, I think that leads on quite well as a segue. It says the current CARS funding, and CARS stands for Care in the Right Setting. So the current CARS funding, though welcome, underestimates what is required on the ground. Rural services are not present on the ground across Queensland, and local staff want services locally, not in large centres. Telemedicine can be an important adjunct, but is not the solution. We're just welcoming comments on that, please.
Perhaps Philip, you might want to address that one first.
Well, I think the current, as Charlotte said, the current CARS fund is Care in the Right Setting, I think it's called, is about, I think, $12 million as a project funding grant that's gone for about 2 years, or 1.5 to 2 years. And I think everyone in the sector involved in that thinks it's a wonderful thing. It's for the first time ever, it's enabled things like medical equipment to be able to be done on a statewide basis, which, as Joe said, whilst palliative care is relatively new, it's taken to 2020 to have a statewide approach for equipment, which is really a basic thing across the state. I think there's also telehealth and a number of other things involved in that, which I think everyone thinks has been wonderful. I guess that the worry in the sector is that it's project funding. It's not guaranteed to go on for longer. And also really need to be built into project funding is what is successful. I think a lot of us think this statewide approach is fantastic. Certainly medical equipment across the state, telehealth across the state is fantastic. I think trying to look at things from a statewide approach is really where we in the sector think so important. While saying that as a statewide approach, I completely agree that what people need on the ground is local services for local communities, look after local people at home or in hospital as they need. So I think it's a really important point from the question.
Great, thanks, Philip. Fiona, Joe, any comments there?
Look, from my perspective, just to pick up on something that Philip was saying there, I don't know that it's necessarily accurate to say that there hasn't been a statewide approach to equipment. I think there's been some significant changes due to the NDIS around the mass scheme, which would have filled would have, I imagine, been where a lot of equipment, etc., would have come for anybody who was engaging with the acute and subacute healthcare system. Certainly that was the case in the rehabilitation setting. And obviously with the advent of the NDIS and the significant changes to mass, there has been a significant readjustment around how we manage medical equipment. You know, what's the old saying? You don't miss the water till the well runs dry. I know there used to be a lot of complaints and etc. about mass, but it actually was an extremely good service. But having said that, the NDIS is also an extremely good thing, and if this is one of the consequences of that, we have to adjust to that. But certainly, as a government, we've recognised through that 2018 review that you need to have access to good quality palliative care, no matter what your situation, no matter where you live, and that is what we are working towards.
Thank you. Any other?
There's another question looking at, does the ask cover training for palliative care specialists and nurses, as Queensland seems to be lacking the workforce in this sector? So it definitely does include funding for specialist palliative care nurses, doctors and allied health. And we've actually specified some numbers in the ask. So we've looked at palliative care medical physicians, 40 FTE increase. Palliative care nursing specialists workforce, 130 FTE increase. Palliative care allied health specialist workforce, which includes bereavement counsellors and spiritual care coordinators, 65 FTE increase. Palliative care administration support staff, including volunteer coordinators, 40 FTE increase. Palliative care clinical educators, 35 FTE increase. And advanced care planning facilitators, 25 FTE increase. I should say that FTE stands for full-time equivalent. And basically that summarises what we feel is needed. And then the appropriate training is also needed for those staff to ensure we have access to workforce at that level as well. And so we have embedded some education and training as well into the ask so that we can assure that's available. Now, these numbers also are helping to meet the Palliative Care Australia Service Development Guidelines, which looks at what workforce is required. And currently we're at about 50% of that workforce in many areas. So this is what's required to get to that level that's recommended nationally.
That would make a huge difference to be able to get those increases.
Shiloh and John, I think it's worth bearing in mind too that we have a Royal Commission underway into a sector where a significant amount of palliation occurs, and I think it would be fair to say that across the board in a whole range of areas we need to invest, in my opinion, as a nurse, into the skills development and training in the aged care sector. I don't want to diminish the extremely good work that's done by my colleagues in the aged care sector, but just as I found in the acute care sector, if you don't have the time and the space and the training and the ongoing support around any particular aspect of your job, whether that's palliative care or hand hygiene or managing intravenous fluids or any other aspect of your skill set, it is hard to deliver good a quality service. So I would certainly, for one, be hopeful that that this matter is being considered by the Royal Commission and recommendations will flow from that.
Could I just follow on for a moment? I think I'd also appreciate your feedback too in regard to attracting people into this vital area of care. And there's obviously a range of specialties and training that people can acquire, whether it's a specialist, palliative specialist, or people are providing palliative nursing across the full spectrum. But do you see there's an issue in rise in also elevating the awareness across not just the public, who I still think don't get what good palliative care is? Is there an issue also more broadly across the medical and health sector to really value what quality palliative care is, and to recognise that it's not just a little tack on to other qualifications and jobs that people have got within a health system?
Fiona, we have included in this the palliative care clinical educator role, and I think collectively we see them as a vital role to educate the generalists in the primary care space. That would be a big part of their role. And also, to respond to Joe, we've also got embedded in this ask a aged care palliative care support package, which looks at specialist palliative care support and consultation services for both residential and community aged care for the amount of 12.5 million. So that's included within this ask, looking at what the state can do in addition to what the Commonwealth needs to do in response to the Royal Inquiry, or Royal Commission, sorry. And so it works together in the space to improve aged care, and we're really seeing that opportunity now with the COVID as well in this during this time.
Well, I think we've just about, have we dealt with all the questions?
There's one more question here about funding to properly train the personal carers who relieve the families and carers so they can get some much needed rest. So respite and carer training is very important, and we do know that that keeps coming up. That is included within this. We've looked at that on multiple different layers actually around how we support that aspect. So it does include particularly looking at community capacity building and volunteers across the state. So really looking at those two angles to support better support carers and the community around them, which should enable them to stay at home and provide that much needed care that they are there, in addition to the specialist and generalist workforce.
Excellent.
I think in relation to the aspect about how to attract people into the sector, I think one of the key things that we have to do is really focus on that A, providing appropriate training for people, and B, appropriate valuation for people. So one of the things that I have been sort of talking about with my nursing colleagues is that a lot of our nursing training is geared towards preparing nurses for acute care settings, and we need to think through aged care, palliative care, rehab, all of these other community care, and we've done a good job in some of these areas, particularly mental health care, but we've got to play some catch up, I think, in terms of properly preparing people for these other roles, and then it will become something that people certainly are attracted to and value. And I think the training of support staff, the training of volunteers, the training of anybody involved in this has to be fundamentally part of anything that we do going forward. Anybody that's stepping forward to play a role in palliative care needs to have proper training and support. And I know I've got the headquarters of Carers Queensland based in my electorate, so I have regular meetings with them, and there's significant supports in relation to the work that they do in terms of supporting those unpaid carers that provide so much of the workforce in this area.
And PCQ works really closely with Carers Queensland, and there's great opportunities in that space to collaborate. And Sue Manton's just popped up into the chat as well, just reminding people about the Carers Gateway and that you can access support through that Commonwealth mechanism as well, which is really important. Thank you, Sue.
All right, thank you, Shiloh. Well, I've got the wind-up signal, so I want to thank all our speakers today. So Joe, Fiona, Philip, our recorded messages from Chris Perry. Who have I missed? Sorry, Ros Bates, and our Michelle, was it, our consumer? Thank you all so much, everybody, for participating. And And lastly, I want to thank Morris Blackburn Lawyers. Thank you, Jonathan, for organising the venue today. Look, as I've said for many years, palliative care funding is not going to increase until voters are knocking on the doors of their elected representatives. I don't think we're quite there yet, but we're well on the way, and I think this coordinated approach from the sector is going to make a huge difference. It's only when government and political parties see that there's a united approach that change is likely to happen. So congratulations to everyone who's been part of this combined approach, and thanks again everybody for participating. Thank you.